Hello, Mr. Travis. My name is Corey. How are you today?
Doing good, sir. How are you?
Doing well. Today we're going to do a head-to-toe assessment on you,
Okay.
and what that means is that I'm just going to evaluate every part of your body from the top of your head down to the bottom of your feet. If we come across any problems or if anything hurts or if we go into pause, just let me know and we'll stop. Okay?
Okay, sounds good.
All right. So the first thing we're going to do, I'm just going to look over your whole body. I'm not going to touch you. I'm not going to do anything. I'm just going to take a general look at you. Okay. All right. And the first thing that I'm going to do, I'm just going to palpate your head, which means I'm just going to touch and feel. Okay.
Okay.
If you notice any kind of soft spots or any tender spots, any sore spots, just let me know. Okay.
Okay.
All right. Is any of that sore?
No, sir.
Okay. Okay, so now I'm just gonna take a look at your face here. I'm looking at your forehead. I'm gonna feel your sinuses here. Are those tender?
No, sir. They're not.
What about these? Is that tender? A little bit? Okay, a little tender. Now do me a favor. Let me get you to raise your eyebrows. All right, put them down. Close your eyes for me. Open them. Now I want you to follow my finger. Do not move your neck or your head. I want you to just follow my finger with your eyes, okay?
Yes, sir.
All right. I want you to take one hand and cover one eye. Tell me how many fingers am I holding up?
Two.
All right. Take the other hand and cover the other eye. How many fingers am I holding up?
Four.
All right. Good job. Now tell me how many fingers am I holding up?
No.
All right. Good job. So what I'm gonna do now is I'm gonna take my pen light and I'm just gonna look into your eyes and I'm just measuring your pupil size, okay?
Okay.
What I want you to do is I want you to just focus on that picture on the wall, okay?
Yes, sir.
Just look at that picture. I'm gonna shine a light in your eyes, but don't look directly at the light. I just want you to focus at that picture. I'm gonna take my pen light and I'm just gonna look into your eyes. Open them real big. Good job. Real big. Good job. All right. So now I'm just going to look at your sclera, at your eyeball, checking out the color in it. Have you noticed any kind of drainage from your eyes?
No, sir. Not really.
All right. Have you been tearful, like having just tears coming out your eyes for no reason?
No, sir.
All right. So those are the eyes. Next, I'm going to move to the ears.
Okay.
I'm just going to palpate your ears, and we're going to do what I call the whisper test. I'm going to whisper some in your ear, and I just want you to repeat back to me, okay?
Okay.
But first, I'm just going to palpate both ears. Let me know if it's tender or sore, okay?
All right.
Is that sore?
No, sir.
All right, just touching the outside of your ear. Is that sore?
No, sir.
Okay. What about drainage? Have you been noticing any drainage out of your ears? A little drainage? Okay. All right. All right. So now I'm going to whisper a word, and it's going to be very softly, but I want you to repeat to me everything that I said, okay?
Okay. 44. TikTok.
Good job. All right. So we've done the eyes, we've done the ears. Next, just going to do a general inspection of the nose. Is any of that sore?
No, sir.
All right. Now I want you to take one finger and include one of your nostrils. And I want you to just hold it down and breathe through your nose. And breathe out. Do you feel stopped up? Or
Yes, sir.
okay, you do feel stopped up? Now let's switch on the other nose. Do the same thing. What about on that side?
Yes, sir.
All right, so you are a little congested there.
Yes, sir.
All right. Have you noticed any drainage coming out of your nose lately? Okay, what color was it?
Great.
Okay, a little greenish. All just gonna look in your nose here. All right. Okay. Now I'm just gonna take. We've done the eyes, we've done the ears, we've done the nose. Now the next thing to do is to move down to the mouth. Okay. What I want you to do now is I want you to smile real big for me. Smile. There you go. Good job. Okay. Now I'm gonna look inside your mouth. I want you to be real, open up real wide for me. And I'm gonna look. All right. Let me get you to say ah. Stick your tongue up. Stick it down. Stick it out. All right. Good job. Smile real big. Now frown. All right. Good job. Good job. Good job. Okay. Have you noticed any soreness in your throat? There's no redness back there. Your tonsils are fine. Your uvula looks good. Your tonsils are normal size, so that's good. Okay. All right. Next, I'm going to kind of palpate your sinuses. Okay. You got different sinus nodes, lymph nodes all throughout your neck, and I'm just going to palpate those. Okay.
Okay.
Let me know if any of these are sore. Okay. Is any of that sore? They're palpable, but they're not enlarged, so that's a good thing. That's what we want. Okay? All right. So now I want you to lay just like you're laying, and I'm just going to listen to your carotid bruit, okay?
Okay.
That's your artery that runs on the side of your neck, and I'm just going to listen to it with the bell of my stethoscope, okay? One side at a time. All right. Sounds good. Swishing. We got good blood flow going through there. That's exactly what we want.
Yes, sir.
All right. So now I'm going to test the strength of your shoulders. Okay. I palpated your carotid pulse on both sides, one side at a time, so that we do not occlude blood flow going to your brain. All right. Now both are palpable, strong pulses +2. Now I'm going to test the strength of your shoulders, okay?
Okay.
What I'm going to do is I'm going to hold down on your shoulders, and what I need for you to do is to just shrug your shoulders, just like that for me, okay? Shrug them. Good job. Push up. All right. Good strength. Good strength. You work out?
Yeah, a little bit.
All right. Good job. Good job. Okay, so we test the shoulders. Now what I'm going to do, I'm just going to feel for your pulses in your arm. You have a brachial pulse, you have a radial pulse. Your brachial is right here on the top of your arm here, and your radial is right down by your thumb. Okay? I'm just going to palpate your pulses. This is your brachial, and this is your radial. All right, other arm, please. Brachial and radial. Normally, I will hold here for 60 seconds and count for a full minute to get your heart rate, okay? All right. So now that we've tested the brachial pulses and the radial pulses, the next thing I want to do before we go any further, I want to test some of your cranial nerves. And what your cranial nerves are, they're responsible for different senses in your body. The first thing I want you to do, I want you to close your eyes. Now I'm going to touch your face with an object. Don't worry, it's not sharp. When I touch your face with this object, I want you to let me know by saying there, which means that you feel it there. Okay? Let me know when you feel it there.
There. There. There.
Good job. That was just a cotton ball, and I was just testing your senses and look like your senses are intact.
Okay.
The next thing, I want you to keep your eyes closed, and I'm gonna give you two objects, and I want you to smell these objects. I know it might be a little tough because you're a little congested right now. However, I just want you to try your best to tell me what these scents are. I'm not gonna tell you what they are. I want you to just try your best to tell me what they are. Okay?
Okay.
Keep your eyes closed. Tell me what you smell.
It smells like pepper.
Pepper is exactly what it is.
Exactly right.
Yes, sir. Yes, sir. Good job. Good job.
My journey is not bad after all.
There you go. There you go. Keep your eyes closed. I have one more object for you, and I want you to tell me exactly what you smell, okay? Let me know.
Citrus smell, some form of juice. Orange juice?
Orange juice. Good
Really?
job.
Okay.
Good job. All right, you can open your eyes now. Good. So we see that your smell is intact. Your senses are intact.
Can I have some of that orange juice?
No, not right now.
Not
Okay.
right now.
When this examination is over, you'll be sure to get you some
Okay,
orange
I'm gonna hold
juice,
you
okay?
to it.
All right. All right. So the next thing we're going to do, we're going to move down. Okay. We've tested all of those up there. But next, we're going to move to the lungs. Okay. There are several different spots that I can listen to for your lungs. But however, for this examination, I'm going to listen to just a few, maybe about 9, 12 different spots on your body. Okay. And I just need you to take in deep breaths. You're going to breathe in through your nose and out through your mouth, okay? Breathe in and out. 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 Now, if I wanted to, I can listen here on the side. Deep breath and out. Deep breath and out. And I would just go along the side. But I want you to sit up for me, if you would. And I'm just going to listen at your back, okay?
Okay.
Deep breath and out. 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 Last one. Deep breath and out. All right. Good job. Lungs sound very clear.
Okay.
All right. So we've done the lungs. Um, and we're going to go back and we're going to do a test just to test the expansion of the lungs, the movement of it.
Okay.
We're going to do that in a minute, but we're going to go and I'm going to listen to the heart, okay? There's several different spots I can listen to, but for this examination, we're just going to listen to 5, okay? All right, and I'm going to name those five as I go along. Well, I'm going to attempt to name those 5, okay? All right. We're going to listen at the aorta. You just breathe normal. And just listen to your heart. Pulmonary. Earth. Tricuspid. And the mitral. And while I'm over here, I will listen here at the fifth intercostal space, mid-clavicular line, to get your apical pulse. I will listen here for 60 seconds to get your full heart rate. And also, this is your most, I guess, palpable part of your heart where I can feel your heartbeat the most here at this spot. Okay.
Heart
So,
sounds good.
heart sounds good. Healthy guy. All right. I want to ask you to lift up your shirt, and I'm just going to do an inspection of your abdomen. Okay.
Okay.
Not going to touch anything right now. I'm just going to look. I see that you got an incision here, midline to your umbilicus. Did you have a surgery here?
Yes, sir.
Okay. What kind of surgery did you have?
Intestinal.
Okay. Intestinal surgery. All right. But you don't have a colostomy, I see. Do your bowels still work fine?
Yes,
You
sir.
do have bowel movements daily or close to
Yes, sir.
daily? Good job, good job. I don't see any pulsations. Abdomen looks good. Looks round. All right. And next, now what I'm going to do, I'm just going to auscultate in all four quadrants, which means I'm just going to listen to four different sections of your stomach. Okay.
Okay.
Great valve sound. All right. Valve sounds are present in all four quadrants. That's a good thing. Um, so I've auscultated, I've inspected. Um, next, what I want to do, I just want to palpate your stomach. If at any time you get any tenderness and you need me to stop, just let me know, okay? Is that sore?
No, sir.
Okay. And now I'm just going to percuss. All right. And we'll percuss a couple of your other organs. This is your spleen. And I'm finding the liver. All right. All right. So we've done the abdomen. All right. So now, what we're gonna move on down. You haven't had any trouble urinating, no pain on urination, none of that, no bleeding when you urinate. Good job. So we won't do any of that. Next, we're gonna move on down to your knees. What I want you to do is I want you to take your knee and pull it up towards your stomach. There you go. Now bring it back down. Take your knee, bend it, and move it outward. Okay, move it back inward. Good job. Now I want you to take the heel of your feet, bring it up to your other knee, and go down your leg with it. Good job. Good job. All right. Now we're gonna do the other leg. I want you to bring that knee up to your stomach. Take it out. Bring it back in. Stretch it back out. Bring it back up. Bring this heel to that knee, and I want you to go all the way down with it. All the way down, all the way down. Good job, good job. Did you experience any kind of pain when you did that?
No, sir.
Good job, good job. So now what I'm going to do, I'm just going to palpate here. I'm palpating your popliteal pulse, okay? That's the pulse that's behind your knee. And it is there, and I feel it, and it's down, and good job. Normal pulses. So I'm checking your legs. I don't see any swelling, no fluid accumulation. So now what I'm going to do, I'm going to check your pulses down in your feet, okay? You have two pulses that I'm going to check here. We have your dorsalis pedis, which is right on top of your foot. And this is bound in +2, good job. Also in that one, it is bound in +2, good job. All right, that was the dorsalis pedis. Next, I'm going to test the posterior tibia pulse, okay? And it's on the inside of your foot, right above your ankle, around that area, okay? All right, good job. It is present and it is bounding +2. We'll take that any day on both legs. Good job, good job. All right, now if you would, I just want you to come stand up here for me. All right, I want you to turn your back towards this way. Now we're just going to test the expansion of your lungs, okay?
Okay.
I'm going to put my hands back here, And what I want you to do, I want you to take a deep breath, real big deep breath. And out. One more. And out. Good job. No frenitus. All right. Shrug for me. All right. Now I want you to turn your neck to this side over here for me. All right. Turn to the other side. All right. Tuck your chin to your chest. Now I want you to bring your neck all the way back. Hyperextend. Good job. All right. Now take it all the way back forward to your chest. Now tilt your head to the right with your chin tucked down. All right. Now to the left. All right. Now let's see if we can just bend it. There you go. To that side. Now to the other side. Good job. Did you feel any pain there?
No, sir.
All right. Awesome. Now turn around for me. Now what I need for you to do is just bend over and touch your toes, okay?
Yes, sir.
All right. Any pain noted back here?
No, sir.
Any pulling? Any muscle soreness?
No, sir.
All that is good. All right. Good job. Good job. All right. So everything looks good. Everything went well. Do you have any questions for me?
No, sir.
No questions. All right. Well, Mr. Travis, I thank you so much for allowing me to do this assessment on you.
Yes, sir.
At any time I can be of any assistance to you, you let me know, okay?
Will do.
Thank you.